Now we are going to discuss from pathology the type 1 hypersensitivity reaction. Okay, see, if there is an allergen like pollen, dust, seafood, there is some allergen and it is entering the nasal mucosa. For example, we'll take pollen, it entering the nasal mucosa. What after it enters the nasal mucosa? The macrophage takes it up. After it takes it presents to T cell. It present to T cell. This T cell give it to T helper cell. Give it to TH cell, that is T helper cell. In this there are two types: TH1 cell, T helper 1 cell, T helper 2 cell. Okay, and here only mostly Th2 type cell are activated. By this allergens will have more attraction towards this Th2, so it is more activated. Th2 is more activated. After this Th2 is activated, it produces interleukin 4, interleukin 5 and interleukin 13. Okay, this interleukin 4 tells the B cell or plasma cell to not to produce IgG or IgM, commonly produce IgE. Don't Interleukin 4 tells to B cell that a B cell don't produce normal or ordinary antibodies, produce IgE. There is some allergy. Okay, after IgE is produced, this IgE enters the blood circulation, and in the blood circulation it goes near the mast cell. In the mast cell there is a receptor, that is FCERI. This IgE antibody goes and attaches here. After going and attaching here, this this is after going and attaching here, it will stay like this only in the blood. This whole process is called sensitization phase. This is called sensitization phase. See, you may get the doubt why in the first step type 1 hypersensitivity reaction is not seen. What actually happens in type 1 hypersensitivity reaction is, see, the pollen should be taken up by macrophage and T cell, TH cell, then interleukin should be produced, then Ig or beta B cell should be stimulated. So to happen all this process, it will take much time. So in the first time exposure of the pollen or allergen, the person might not land up in hypersensitivity reaction. But whenever for suppose, see, second time the pollen again came, this pollen now don't go all these steps, it directly goes in the blood near this mast cell IgE antibody attached site and makes this mast cell to burst. After this mast cell is getting burst, what happens? After this mast cell is getting burst, it will release histamines, it will release proteases, it will release chemotactic agents. Okay, the second time exposure of allergen directly came near the mast cell, which is attached with the IgE antibodies and made the mast cell to burst, which released histamines, proteases and chemotactic agents from the mast cells. Okay, after these are released, we'll talk about the histamines. These histamines cause swelling. Why they cause swelling? Because in these are the blood vessels, they cause vasodilation. Due to vasodilation, fluid leaks out and cause edema. This is due to which swelling is happening. And in the nerves, it this irritate nerves and produce itching. This irritate nerves and produce itching. Okay, these two are finished. And in the lungs, it constrict the bronchi, and it cause shortness of breath. It causes shortness of breath. Okay, what all happening? Edema, vasodilation, itching, shortness of breath. Okay, these all happen in anaphylaxis or anaphylactic shock or type 1 hypersensitivity reaction. Okay, these are the conditions which you're going to see: vasodilation and edema. And due to this vasodilation, there will be, see, after vasodilation the volume is leaking out, right? The volume of blood is decreasing, so there will be hypovolemic shock. Hypovolemic shock. Okay, and there will be fall in BP. This is known as anaphylaxis. Okay, we had known about the mechanism how this happens. And one more, after this mast cell are getting activated, they also synthesize some other things. Those are leukotrienes, then prostaglandin D2, and also cytokines like interleukin 4 and interleukin 5. Okay, after activated mast cell burst, okay, some other mast cells also will be there, right? Those will produce this cytokines, leukotrienes, and PGD2s. This cause vasodilation and bronchoconstriction. Leukotrienes cause strong bronchoconstriction, and this interleukin 4 we already discussed. That is, in the B cells, it tells to not to produce IgG or IgM, but produce IgE. Okay, and here interleukin 4 is finished, and now interleukin 5. This interleukin 5 attracts eosinophils. We know that eosinophils are mediated in allergic reactions. So after this interleukin 5 is produced, it will attract more and more eosinophils, and it will cause eosinophilia, more allergic reactions and more inflammation. Okay, this is all about the type 1 hypersensitivity, and there are two phases. One is the initial and the late phase reactions. Initially, what suddenly we can have, even in seconds, even minutes, even 1 hour, even within an hour, what we can have: vasodilation we are having, so fall in BP, hypovolemic shock, then severe shortness of breath, then rash, okay, urticaria. Okay, these all will have immediate, initial or immediate phase reactions. Okay, then in the late phase, the eosinophils are what accumulated, right, due to interleukin 5. It might cause eosinophilia. It might also cause Th2 cell accumulation more and more. So this might lead to prolonged inflammatory reactions, which might lead to prolonged tissue damage. Okay, this is all about type 1 hypersensitivity reactions. Thank you.